Hi, today I'm going to talk to you all a little bit about Crohn's disease and what this disease is. So first off, what is Crohn's disease? Crohn's disease is an inflammatory bowel disease that affects the gastrointestinal tract from the anus to the mouth. And what happens is, Crohn's being an autoimmune disease, this causes the immune system to attack itself. And throughout the intestines and the esophagus, you develop fistulas and inflammation throughout the entire intestinal region, and this can cause severe abdominal pain and many symptoms. Some of these symptoms being abdominal pain, and this can lead up to vomiting, and vomiting can cause weight loss. And weight loss, you're not wanting to eat because of the abdominal pain, and it causes you to vomit a lot. You can develop skin rashes, and these are physical symptoms. Arthritis and many joint pains in all of your joints, like your knees, your fingers, and inflammation of the eye sockets, and this is a big symptom. But two main symptoms are fatigue, becoming very lethargic throughout the days, not being able to finish your days, and rectal bleeding, which this is caused by the inflammation and ulcers throughout the intestines. So medications. These obviously aren't all of the medications that you can use for Crohn's, but these are what I'm familiar with and what I've taken. So Imurin, or azathioprine, is a drug that you take it and it goes in and it revamps your immune system, and it goes in and tells your body to which cells not to overproduce or which cells not to produce. Remicade is an infusion, and you do Remicade 2 weeks, and then you go in and 2 weeks later and you take Remicade again every 2 weeks until 8 weeks, and then you go every 8 weeks. What Remicade is it's also just like Imurin, and it stabilizes the immune system, but this is more like the last resort drug. Like, no other drugs are working, so you have to resort to Remicade. Flagyl isn't really drug-based for Crohn's, but it's more of an antibiotic. And with Crohn's, you have fistulas and ulcers throughout the lining of your intestines, so you're really prone to developing bacterial infections. So what Flagyl does is an antibiotic, and it goes in and it rids the cells of this bacterial infection. Prednisone, or it's also known as the miracle drug, it goes in straight and it just hits the inflammation straight on, and it rids the entire body of all inflammation and everything. So this, I know it looks bad, but this actually is very healthy intestines, and this is the everyday person's intestines after a clean-out procedure. But this is the intestines of someone who has not been treating Crohn's. This is, you can see on the lining of the intestines, it has developed fistulas and ulcers all throughout the lining, and is very inflamed at the moment. This is the esophagus, and this region right here in the body, and you can tell right here that it's very pretty, and there's nothing wrong with it at all. Well, I think it is. But this is someone who has Crohn's. You can see the lining of the esophagus is very swollen, and it's developed lots of inflammation. It's made it very hard for someone to enjoy their meals. Surgery. So what types of surgery can you do? There's two surgeries that they do when you go in to have surgery. One is called an endoscopy. This is where they take an endoscope, and this is just a tube-like structure with a camera on the end of it. And what they do is they heavily sedate you with general anesthetics, and then they go in from the mouth and down into the esophagus, and every few seconds this camera on the end of the tube is taking pictures of the lining of the esophagus all the way down at the beginning of the small intestines. The second surgery is called a colonoscopy, and this is where they insert the endoscope. It's a different endoscope. They insert a different endoscope through the anus up into the large intestines and to the small intestines, to the base of the small intestines. And what they're doing here is they're basing these pictures off, and this is how they can diagnose a patient who might have Crohn's or something else. Cure. As of today, there is no known cure for Crohn's disease, but every day researchers have gained more knowledge of Crohn's disease and what this disease really has. So hopefully in the near future we will find the cure to Crohn's. Thank you.